And now for medical rounds, Leqembi is a milestone treatment option for patients in the early stages of Alzheimer's disease. It's been shown to slow the progression of the disease by 27%. Joining us today with more about this is Dr. Mark Alberts. He is the co-physician-in-chief of Hartford Healthcare Ayer Neuroscience Institute and the chief of neurology at Hartford Hospital. Doctor, thanks so much for being here. We appreciate it. Can you talk to us a little bit about how many people nowadays are affected by Alzheimer's disease?
Good afternoon, Kara. Yeah, Alzheimer's disease is common and it's becoming more common. Currently in the United States, there are about 6 to 7 million people with Alzheimer's disease. And because of an aging of the population throughout the United States, including Connecticut, we expect the number of people with Alzheimer's to increase significantly over the next 10, 20, and 30 years.
Wow. So how can Leqembi really help slow the progression of Alzheimer's disease?
Yeah, so that's a great question. Leqembi is given as an IV intravenous infusion, and it circulates in the blood, and it works by pulling out this bad protein called amyloid. It pulls it out from the brain, and by reducing the amount of this amyloid protein in the brain and basically getting rid of it or reducing the burden of it, data shows that Leqembi can improve the function of patients with Alzheimer's. It can improve their thinking, their memory, their speech, their ability to reason. And this has been shown by these large clinical trials, and it's a very consistent and persuading evidence of the effects of Leqembi.
Wow. So who's the best candidate for Leqembi and how is it administered?
Yeah, so the best candidates are folks with the early stages of Alzheimer's disease, where the effects of their memory and thinking are relatively mild. Unfortunately, if it's very advanced and the patient is in a nursing home and they can't take care of themselves, those sorts of folks don't seem to respond to Leqembi the way the way folks in the early stages of Alzheimer's disease respond. And it's given intravenously every other week. So you have to get that treatment at a special infusion center for several months before you see the effects of it.
Okay. What can patients expect if they can do this?
Yeah, so as they get the infusion, their thinking and memory can improve, or at the very least, the rate of progression will be slowed. So clinically, they may stabilize, if not get a little bit better. And in a progressive disease like Alzheimer's, if you can stabilize or reduce the progression, that translates into months or even a few years of improved thinking, memory, function, and quality time with loved ones.
Dr. Mark Alberts, thank you so much for this information. I hope it helps so many people out there. We really appreciate it. And if you want more information, you go to hartfordhealthcare.org/neuro or hartfordhealthcare.org, as you see right there.